Hello, I am Dr. Saravanan. I am a senior interventional cardiologist and cardiac electrophysiologist. I trained in the UK. I came back from UK in 2017, and since then I've been practicing in India. Currently, I'm practicing in Bangalore as a medical director and chief of cardiology in a medical college hospital at East Bangalore. And today we are going to discuss about heart attack in the young. When I left India to go to the UK in 1999, we never saw young people below 40 years of age having a heart attack. It was extremely rare, and if it happened, it will come in the evening newspaper as a news item. Today, we are seeing 3 or 4 young people having heart attack below the age of 40 on a daily basis in every single hospital in the city of Bangalore, and similarly every other city in India. This is very unique to India. And when I discuss this with my counterparts in the Western world, they are very puzzled as to why this is happening. The question is not about why it's happening, how we can prevent this, and what to do when they have a heart attack. When young people have heart attack, it leads to damage to the heart muscle, and they will end up developing a condition called heart failure, where the heart becomes weak, and because the heart is weak, subsequently they will be affected by that in terms of their ability to do work, ability to go and succeed in their life, and they become more of a burden to themselves and the society. So once a young person gets a heart attack, how best we can deal with that heart attack and then ensure that that person is at least, if not cured, at least controlled from the effects of the heart attack so that he or she doesn't develop a heart failure. That is one area that we will talk about. The other area, which is even more important for a country like India, where we have an epidemic, an explosion of heart attacks in the young people, is to identify the root causes and try and prevent this from happening, avoiding this heart attack. So we will discuss both aspects, and in that context, one area that I have been very interested in is to see how we can use the best of modern medicine and the best of traditional Indian medicine, put them together and create an integrated care approach by which we can get the best for our patients. I have teamed up with Shathayau Ayurveda group, who are a very well established and a high reputation Ayurvedic treatment group, and Dr. Swami, who heads that group, and we have come up with a plan by which we can deal with people who have had a heart attack and help them recover back onto their normal healthy lifestyle, and this is called an integrated cardiac rehab program. We have also come up with another program, which is an integrated cardiac education and rehab program, where we will focus on young people who are at high risk of a heart attack and discuss lifestyle modification and various other interventions that will prevent the heart attack. So there are 2 angles to what we are approaching. The first is any young person who has had a heart attack, or even people who are above the age of 40 who have had a heart attack. If they wish to have a full recovery from the heart attack, the medicines, the stents, the balloons that I put in treat, they are only going to fix the immediate problem. The risk that they have of developing complications from the heart attack and also a second heart attack can be prevented by this cardiac rehab program that we are building. So first, let's look at a situation where a young person has had a heart attack. And if they have had a heart attack, they first come to me as an emergency. I see them, and then I treat them with a condition, with a particular treatment called primary PCI, where I take them to my cardiac catheter lab. I do a coronary angiogram, go into the heart, look at the arteries, find the artery that's developed a block, and then try and put a stent inside. It's a metal tube called stent. I put that inside and then do a procedure called coronary angioplasty or primary PCI. And when I do that, I re-establish the blood flow, and then the blood flow then improves the function of the heart. This is basically like, if your car has developed a repair, if it's a punctured tire, you go and fix the puncture. You don't fix the problem. So this is what we do. And after that, then I start them on medications, and then I discharge them. Unfortunately, in India, 50% of the patients don't even come back for a follow-up. And therefore, it is very important for those who have had heart attack to understand why they had one and how to prevent the next one. So I have come up with this plan where we will be, Dr. Swami and I, from the Shathayau group and myself, we will jointly offer you, the young person who has had a heart attack, if you're watching, a chance to have a week-long program in which you will be attending our retreat center in Devanahalli near the airport, Bangalore airport, where you will be a resident for a week, where we will address every aspect of lifestyle modification, which includes but not limited to, number one, dietary with a very senior nutritionist, number two, exercise physiotherapy with a very senior cardiac rehab physiotherapist, medical management by myself, and Ayurvedic management by Dr. Swami and his team. There will also be focus on traditional Indian methods of exercise such as yoga and meditation, along with stress management. So once you get a comprehensive idea of what to do and what not to do after a heart attack, the chances that you will get another heart attack is very, very small. When I was practicing in the UK, every patient who had a heart attack was referred to a cardiac rehabilitation program. Unfortunately, we don't have that practice in India for obvious reasons, because there is not much commercial interest in preventing a heart attack. So everybody is focusing on treating because that makes money. So I do those procedures, I do make money from that, but my focus is that the person I am treating should not have another heart attack. And that is why we think that this program of cardiac rehabilitation, which will focus on a long-term solution to that problem, will be very, very effective and useful. So if you would like to know more about this cardiac rehabilitation program, please call the number that's displayed in the TV, and one of our team will take you through the process and explain to you how it works, what it costs, and when it starts, etc. It usually is between Sunday to Sunday for a whole week. We are also planning a short, brief introduction to the rehab program for a 3-night Friday, Saturday, Sunday program, which also is available, but I would recommend the longer one where you will get the most benefit. But if you are a busy professional, you can't take time off, then definitely have a taster with a shorter program. But these two programs address the same question of how to prevent a heart attack if you have already had one. The next situation is where a lot of young people who are very busy in their lives, make a lot of money, but are having a very high risk of a heart attack. Let us take the example of Mr. Puneet Rajkumar, a very highly respected and very highly known, high-profile individual, young man, fit otherwise, but had considerable amount of stress in his life, plus various other factors that led him to have a heart attack, from which unfortunately he did not survive. The same thing can happen to any one of the youngsters of his age who is watching this program. So it is very important to find out what is your risk. And this entails a number of different methods where we will have to do some tests such as blood tests, running on a treadmill or making you walk gently on a treadmill called treadmill test. And there are other tests such as a CT, coronary angiogram, and a blood test to look at your cholesterol levels, blood test to look at the long-term effect of any high sugar levels in your body, regular recording of your blood pressure, your stress levels, your habits, your diet habits, your smoking or alcohol habits, etc. So what we would do in that context, and what we are planning to do as a primary prevention, which is prevention before a heart attack, is again another program. So the program has two groups. One group will be people who have already had a heart attack who will come to us. We will look at how to optimize their treatment, how to give them the best rehabilitation so that they can go back to their normal lifestyle. The other group will be those who have not had a heart attack but may have a risk of a heart attack. So they come to us, we do an extensive assessment initially to see what is the risk, and anyone who is at a higher risk, we would recommend a week-long focused rehab program to focus on lifestyle modification, stress management, and all your habits. So if you are someone who is addicted to particularly smoking and it's very difficult to come off certain addictions, we would help you with that. We would help you with regular exercise, and that is something that is almost not seen in the youngsters of these days, particularly the IT sector, where people are working very odd hours for the American and the European times, and then they don't have enough time to spend on their own health, and also their diet is extremely bad. I see a lot of IT sector people who have heart attack at a very young age, and it's very important that we will identify those who are at risk, and when they are at risk, then we will offer you this risk assessment plus rehab, where you will benefit from interventions that will change your lifestyle so that you can prevent a heart attack. Anyone who is interested in this program, please call the number and we will take you through which of these two programs would be suitable for you, and then we can discuss the next steps forward. Thank you very much.